Electronic health records are taking over as a new way to provide improved patient care. This information provides patient demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, lab data, and radiology reports, all available to all providers, where we can simultaneously all have access to that information to better care for our patients and their needs. The EHR automates and streamlines the clinician's workflow. The EHR also has the ability to generate a complete record of a clinical patient encounter. This will support other care-related activities directly, indirectly, all through various interfaces, including evidence-based decision support, quality management, outcome reportings. We are now gathering information and using the technology that we are now having to make healthcare more efficient. In the US, we have gone from 10% electronic health records to over 90% within the last decade alone. Now we start seeing the value of AI. The electronic health record allows us to better and more efficiently communicate with our patients. For starters, patients now have access to their health record. They can view lab results. They can message their physicians directly. Having this patient direct access to their healthcare providers will also strengthen our relationship with our patients and the patient-clinician interaction. With a stronger relationship comes more trust. With more trust, the patient is more willing and more open to communicate with us, with our providers, to be more honest, tell us how they're really feeling, give us their symptoms, tell us what's truly going on. With that information, we are less likely to misdiagnose these patients. Also, with the EHR, what we make available is video conferencing. Have you ever had a specialist that you were looking for, but there weren't any at the hospital? Did you try and call and reach them and you couldn't reach them? Well, now we have video conferencing where there's a specialist available 24/7, no matter what department, all at your disposal because you need them. You're in the room with a patient and you don't know what to do, or you need some more input from a specialist or a physician, a clinician. We now have that available. They can be video conferencing you while you are with your patient, helping you, teaching you what the next step is with that patient. Furthermore, what also comes with EHR is predictive analysis, using digital data that can be used to determine the best route of practice for various patients, those with high cholesterol, those with COPD emphysema, those with diabetes. What it is, for example, what we do is we're going to be taking data from where you have a certain situation and determine what group A strategy was, what group B strategy was, and which one worked more efficiently. Furthermore, what also comes with EHR is predictive analysis, using digital data that can be used to determine the best route of practice for various patients, those with high cholesterol, those with COPD emphysema, those with diabetes. What it is, for example, what we do is we're going to be taking data from where you have a certain situation and determine what group A strategy was, what group B strategy was, and which one worked more efficiently. We're going to take this information-derived data and turning it into knowledge and ultimately utilities, whether it is with the physician, whether it's family practice, or with the clinicians in the hospital setting. That is why we're fully supporting that vision, the innovation, and the idea and the drive for it. This will be critical to operations, personalized care to physicians, or clinical support. We will also be having apps. With those apps is going to be visualizations that can be provided to the patient. With that, we can also provide how-tos for patients regarding their treatments, such as pursed lip breathing or how to use their medication properly. For instance, how to use their inhalers, how to use a spacer, and what inhalers you can use with that spacer. But furthermore, this app and this technology and the visualizations aren't just for the patients. They're for all of us. Who in here has never forgotten what something is for or how to do something, right? Sometimes we all need refreshers on things we have not done in a while or that we haven't taught in a while. The merging of technology and information is going to allow us all to be more efficient with our charting, give us more time with patient interaction and patient care. This will do nothing but allow us to have a better outcome for our quality of care for our patients, and that's what matters most. What matters most is our patients and the quality of care they're receiving, as well as how they will be doing in the future because of the quality of care we're providing. And this is why we are striving for this. For a long time, ourselves as well as other healthcare organizations have been using social media for marketing and branding purposes. People always share their intimate things regarding their medical problems with their friends and family over social media. Some even message physicians directly and ask for advice. For instance, Dr. Ken Jeong, who is also an actor that appears in The Hangover and other movies as well, receives and replies to messages from people or individuals who ask him for medical advice quite often, actually. Tremendous opportunities for hospitals to tap into social media tools in order to get patients to become more engaged in their care. Information and data that are obtained or generated as a result of these interactions have a valid phase in the patient record. And this is pretty valid just as much as any other self-reported piece of information because this is coming from the patient themselves. So, what is a very big concern, of course, is patient privacy. But patients do have to be educated about what counts as protected personal health information and what doesn't, because we do not want to, of course, violate HIPAA. But of course, on the other hand, patients aren't going to go out of their way to, look up messages on Tumblr or reply on Facebook. But this is an accountable care change that will probably change the way physicians get paid for their services. For instance, the EHR incentive programs can start to stress the patient engagement and patient-provided data as part of their routine care. So providers will need to start thinking about using the internet to gain an edge to boost their financial and quality outcomes, but this will be an overall benefit to both the hospital, the physicians, and any facility, which is why we're still really trying to stress this forward, because it benefits not just physicians, not just the hospital, not just any other healthcare provider, but most importantly, the patients themselves.